Life expectancy and mortality rates of Black and white Americans has improved in the last 50 years. However, higher mortality and morbidity rates are witnessed in Blacks than whites. The health sector has inequalities translating to disparities in access of care services. Disparities in the sector are sparked by discrimination and racism. The COVID-19 pandemic exposed the degree of racial disparities existing in the health sector. Background: 54,968 respondents sought to determine inequality in the health sector of California. 5% of the participants said they experienced interpersonal discrimination in the sector. The discrimination was influenced by gender, insurance, and race. Another study sought to evaluate racial attitudes towards innovative technology. 171 Black and white patients in Veteran Affairs Medical Center participated in this research. The study concluded that the participants had varying attitudes towards medical innovation. Whites had a higher likelihood of accepting medical innovations than Blacks. There is a significant gap with regards to research that focuses on discrimination in the sector. Racial disparities. Disparities exist in the health sector when providing services to different people. Ethnicity and race are variables that have contributed to inequality in the sector. The criteria used to classify people have shifted due to increased population of minority groups. Currently, minority groups make up 37.9% of the country's total population. By 2044, minority groups will constitute 50% of the total population. By the year 2060, 1 in 5 Americans will be a foreigner. An increase in premature deaths and chronic illnesses among minority groups compared to white Americans indicates inequality. Some Hispanic Americans access good health care services compared to Native Americans. Inequality and disparity appear to be diminishing in the health sector. This is not due to improvements, but because of deteriorating critical areas in health. There have been significant efforts geared toward reducing the health disparities. However, a rise in HIV cases and AIDS cases related deaths and infant mortality among minorities continue to persist. The mortality rates in the country dropped by 14% between the years of 2004 and 2014. Infant mortality rates among minority groups are 60% more than the white population. The incidence chronic illnesses continue to disproportionately affect different ethnic and racial groups. 48% of Black women and 44% of Black men have some form of cardiovascular illness. Homicide and suicide are highest among Black men and American Indian men. Native American health. Native Americans have a distinct legal and historical foundation. 567 Native American tribes are federally acknowledged. 13.2% of Native Americans complain of receiving poor health care services. Native Americans have 50% higher mortality rates than white Americans. Native Americans are at a higher risk of suffering from chronic illnesses than whites in the country. For instance, Pima Indians have the highest incidence of type 2 diabetes. The historical trauma that the Native Americans have gone through have translated to mental health problems. This graph illustrates the disparities in diabetes-related mortality rates among whites and Native Americans.
From my experience with treating patients here, I'm finding that we have more than half of the COVID cases are within the African American population. And that speaks again to the health disparities that we have here.
We're seeing high rates of death and illness among African American, Hispanic, Latinx populations. And so we're failing to protect our vulnerable.
In the state of Connecticut, for instance, I think it was quoted that 8% of individuals who are white who test positive. Over 30% of individuals who are black are testing positive. We know that there are a number of contributing factors that take place in the black community, making individuals more susceptible. And these are all under the general area of discrimination and racism that's taken place over hundreds of years in terms of America and continue today.
The pandemic has revealed terrible disparities that we've tolerated for far too long. Those extend to systemic racial injustice as well as healthcare disparities.
A lot of African Americans have to, work more than one job, and getting paid sick leave is an issue. So a lot of people will still go to work even when they don't feel well. We need to give health for all and quality health for all. We have to deal with this health equity issues that we have, and that's an underlying issue that we really haven't resolved.
There are trust issues from decades and centuries of racism and biases. That distrust has been created where, whether it's doctors or medical people or frontline healthcare workers, you typically trust the types of people who actually look like you. As a result of that, we need to work a lot in creating that trust.
Systematic racism in hospitals. The COVID-19 pandemic highlighted health disparities among minority groups in New York. A study revealed that skin color determines where one receives healthcare services. Whites receive medical services from leading hospitals because they have a private health insurance. Blacks access medical services in public hospitals or private clinics because of a lack of insurance or Medicaid insurance. Black males did not access preventative medicine in the past. This has translated to increased disease and mortality rates among the present Black population. This chart shows racial disparities in 2 specialty hospitals in New York. Memorial Sloan Kettering, a cancer hospital, has only 9% of its patients being Black. Hospital for Special Surgeries, HSS, specialized in orthopedic illnesses, has only 5% of its patients being Black. Alternative viewpoints. Minority groups record high mortality rates and illnesses compared to whites. Not all medical staff are racist. They work in racially prejudiced environments, influencing the way patients are treated. Racism and religious intolerance were fueled by politics. In response, physicians wrote letters to reassure patients of their commitment to serve all people. In order to fight discrimination in the health sector, all stakeholders must recognize and control their prejudice. There is an urgent need for increased awareness of discrimination among all medical personnel and students. This will enable them to practice respect, peace, and tolerance towards all people. Solutions in overcoming racial disparities. The salaries of all direct care and reproductive workers to reduce racial disparities in the sector. Racial fairness should be promoted in compensation and creation of career ladders among all workers. Upward mobility of employees should be accompanied by training programs. Medicare should review its roles in maintaining systematic racism in the health sector. In conclusion, the health sector is full of disparities due to discrimination and racism. These disparities influence the quality of health services provided to minority groups. The COVID-19 exposed the level of racial disparity presented in the health sector. Health stakeholders must introduce changes and reforms to address the prevailing disparities in the sector. The federal and institutional reforms should address the inequalities and promote the inclusion of all people in accessing good health care.